next session is bird's eye view. And in fact, if we've been following the discussions since morning, we are already presented with a challenge. We know that either a fear of the third wave still looms large. We got to up the vaccination drive. And then we also have the economic costs as well as opportunities attached with that. But the fact of the matter is that we have never had it so bad in our lifetime. For the first time, as Samir also talked about in the morning, the health workers felt helpless. Hospital corridors were jostled by COVID patients gasping for oxygen. Gory pictures from all across the country poured. And I'm sorry to say, including floating corpses and half-burned bodies being consigned to the rivers and so on and so forth. Least talk, the better it is. Nation peaked to upwards of 4.6 lakh cases a day with more than 5,000 deaths. The numbers have since dropped to less than 45,000 and 800 odd deaths. COVID so far has left nearly 500,000 dead. So what are we talking about? Till this point, while the drop in numbers has been steep, it seems to have plateaued here, and this must be a cause of worry. There are lessons in handling the second wave. While we quickly put ourselves together, we upped the vaccination drive. Already vaccinated 33 crore with 4.3% fully vaccinated as of this morning. Alarm bells were also sounded by the Prime Minister when he said, while launching the program to train 1 lakh youth as frontline COVID workers, that virus is present and possibility of a mutation is still there. We talked about centralization. We talked about decentralization. We also talked about micromanaging the crisis. So we have all the options in front of us. Probably these are the learnings we have from the second wave. In the process, several successful models have emerged. Most talked about the Mumbai model, the Kerala, Bhilwara, and perhaps even a Haryana model, and so on. That means to say that our response to COVID has become localized. So there is need for a concerted strategy, state by state and district by district. Role of all tiers of administration, center, state, district, or municipality, must be made very clear. The state government should assess its requirements and optimize the use of health facilities, and districts should plan and execute as per local requirements, because this seems to have returned desirable results. So what are the questions in front of us? What options do we have? Is decentralization the key? Why without digital fight back, it will be a lost battle? And how are we ramping up infrastructure? So in this panel, we are joined by our experts, Dr. Dipalipan Joshi, who is Distinguished Fellow, SKOCH Development Foundation and member of Executive Council, University of Allahabad, and former Executive Director, Reserve Bank of India. Dr. Shefali Das, Distinguished Fellow, SKOCH Development Foundation and former Director General, National Informatics Center. Mr. Madan Mohan, Senior Fellow, SKOCH Development Foundation and former CGM NABARD and CEO NABARD Consulting. Our economist viewpoint is being presented by Professor Amirullah Khan, Research Director, Center for Development Policy and Practice.
May I invite Dr. Dipalipan Joshi? She also has been a very strong supporter of SKOCH Development Foundation and our work, specifically on the areas of inclusion. And she's had some very important points to make on the role of digital technologies. So may I invite Dipali ji?
It's a very great pleasure, Samir Bhai, great honor and privilege to be part of your seminar, and I salute your indefatigable zeal in organizing these seminars, which are on subjects of very topical and of very great importance. And we are at a juncture in the nation when people must ratiocinate, cogitate, and think about these things. You very rightly put it that our great Hanumanji was the first public servant, and he did all that he could when, like your Asterix character, the sun, the sky falls down. We have to take cognizance of very many things which we had not taken into account earlier. And the first of these is the thing which the pandemic has given us great primacy to is the role of digital India and the need for a digital penetrative reach. Now, monitoring of the level of the pandemic, telemedicine, digital hand holding, and all support services become very essential. And if we are to tackle the third wave, we have to hone our skills in best deploying and using these. Now, the good Mr. Gursharan has also helped me and my thought processes and clarified that dashboards, monitoring surveillance, mapping, tracking, tracing can just not be done without imbibing digital technologies. There is a very great need today to ensure value based healthcare with innovative technologies. And as you have so often spoken of the need for leveraging media, including social media, and for gathering feedback from across all digital interactions and adapt to the rapidly changing expectations. Gunnar Myrdal long ago had talked about the revolution of rising expectations. We are faced with it. Today, we have to, even forums like the one we are having today, feed into policy making. Let us not have any illusions about it. And therefore, Scotch, this forum becomes very important. Likewise, global use cases have also to be studied. The successes in handling COVID so far have been those which are micromanaged. For example, MCGM, which equipped all its 24 wards with an individual dashboard, created war rooms with a dedicated team of doctors and 10 ambulances each. The call was taken by the wardroom on the need for the patient, hospitalization, bed allocated, ambulances sent, oxygen at the ready. This eliminated the first thing which we have to combat in a crisis. It's like people who go down a staircase in a fire and push each other because there is a situation of complete panic. So the first thing to address is this panic. The second thing, naturally, is to improve the response time, provide decentralization, and key in allow the built-in adequate infrastructure to kick in. During the first wave, the Bhilwara model has been praised for tight surveillance, track and trace all early hotspots, go house to house, and a ruthless containment that rids the district of all positive cases. Isolate, contain, and react. So now the question is, if MCGM could do it being the richest municipality in the country, what about the others? Is the money going to be a constraint to the health of India's citizens? How do we address this? During the second wave, likewise, the Kerala model set an example and enabled Kerala to beat shortages in vaccine, despite the country reporting shortages and parallel waste. Kerala used efficient use of vaccines and shone. Each vial, as you know, or as I have been taught, contains 10 doses, but manufacturers add one extra dose, buffering for the wastage dose. By minimizing this loss, the alert and educated health staff managed to administer up to 11 doses from each vial. So there was a zero wastage in efficient use, and the state managed to vaccinate more people than the actual doses provided. So, in sum, there is a need, as we have been hearing from the morning, from various experts, and particularly from you in your introductory remarks, that there is a need for a concerted strategy which should go state by state, district by district, village by village, block by block, household by household, till you are able to drill down to the last mile and to the last man standing. So I am of the confirmed view that participatory dialogue in an empathy-filled environment like this one is essential for getting everyone on the same page. And so you are providing an invaluable fora to build a consensus and to remove these fears which seem to dog our die-hard civil activists that A, we are all going to die, as you said, the sky is going to fall, chicken licken, the sky is falling. B, that we will not be able to escape it. C, that there is the inevitability of a third wave, which Mr. Debroy also addressed. And overwhelmingly, the lesson or this line I've heard from everybody, from you, sir, Mr. Samir Kochar, and from Gursharanji is, let us not panic. Let us keep calm and carry on and use all that is at our disposal, and we shall come out victorious and triumph over the third wave as well. We are equipped, we have all the tools at our disposal, and we know exactly how to use them. So once again, I thank you very much, not only for organizing this great seminar, but also for indulging me and having me on your panel. Thank you so much, Samir Bhai. Best
Thank
wishes.
you so much, Dipali ji. Pleasure as always listening to your wise counsel. Gulshan,
Thank
do
you.
we have Dr. Ramachandran back? What's the schedule here?
He's with us. He's with us.
Yes.
Great.
Dr. Ramachandran, may I now invite you for your address. You have already been introduced to our audience, and very lovingly so.
And the case of the missing chief guest has been solved.
Thank you for this invitation. Uh, uh, See, when we have general topics like this, the problem is quite often the points could get repeated. So I had prepared based on the common format given to me preparing for the third wave. And I thought there would be probably specialists who would be addressing different aspects of it. What I'll try to do is just quickly go through some 10 points or so, trying to cover the issue of preparing for the third wave. So whether there is going to be a third wave or not, that is not a point to be discussed. I think some discussions have already taken place. But learning from experience, it is quite clear that we have to be still prepared for what is going to come. So one of the first points I'd like to make is the lessons to be learned from the experience so far. When we started sometime last year, beginning, we were sort of groping in the dark. So there were a whole lot of issues, centers, states, city level, villages, and all that. I think that has been covered to a large extent, and there are various lessons learned. One of the prominent ones would be how to address the issue relating to migrant laborers who feel very unsafe. Also, issues relating to children. So I'll just refer to two important reports in this context. One is the independent panel set up by the World Health Organization, and a report titled COVID-19 Make It the Last Pandemic. And it says the pandemic has shown us that this is not only a health crisis requiring medical solutions. It's important to know that it has gone far beyond the health sector, and therefore must involve whole of government and whole of society, political decision making and investment. So that is one key point. It's a question of all working together. And of course, from a longer term point of view, what the panel has recommended that WHO should establish a new global system for surveillance based on full transparency by all parties, using state-of-the-art digital tools to connect information centers around the world and include animal and environmental health surveillance with appropriate protection of people's rights. So this is again could look like in the long run, but there is no restriction as far as starting work on these are concerned. Moving on to another report, the Institute of Development Studies has come up with a study on how Kerala appeared to be doing well. I hope it's still doing well. Kerala's grassroots-led pandemic response. So one of the success factors and the reasons the report says is it has been dependent on many factors, such as the prevailing political, economic, and social fabric of the state, including strong public health systems. And that makes Kerala stand apart. Key lessons from Kerala's success is that where there is a political will, an effective life-saving response to a pandemic crisis can be achieved without excessive expense. So that is the financial part of it. The experience of Kerala also demonstrates that empowered local self-governments to whom powers are devolved are an effective way to address challenges in times of crisis. That's also a key point. Kerala's quick response to COVID-19 contrasts sharply with the experience of many other states and is a demonstration that epidemic preparedness does not start on the eve of an outbreak. The ward level community groups played a key role. They invested heavily in training grassroots level health workers to provide quality treatment and regular health monitoring for citizens. The ASHA workers played a key role. The Kudumbashri members, the self-help group, they also played a key role. So these are, I mean, this is not a summing up of all the lessons learned, but these are some of the key points which have emerged based on what we saw as the first wave or the second wave so far. So what is it that we have to be careful about if there is a third wave? It has to be clearly understood and clearly explained. And how long can that be? So what is it that can be done to avoid its harsh impacts? That would be a key point to be addressed, in which everyone gets involved. It's not just the government alone. So what is important is communicating with people. This is a lesson which is emerging from most of these instances. I don't know whether the Mumbai experience would be shared. Mumbai looked a very, very sad case in the beginning of the year last year. But then how under the leadership of Commissioner Chahal, they have been able to make a big change, and that has started getting referred to global level, national level, by courts and the like as what is called the Mumbai model. And it's something remarkable. So there are lessons to be learned from that also. What happens is once the event or incident is over, we tend to forget. But at this stage, there is going to a third wave. What is important is to understand what happened, what went wrong, what needs to be corrected. And then communicating with people becomes very important. And that is where in the city areas, ward level becomes a critical level. And also, I think there are enough lessons about political parties holding huge congregations, festival times, the tendency to get out and get together. When elections have to happen, how is that to be managed? So one hopes that, because again, if it goes beyond July, August, September, we are entering the festival season as well. One doesn't know about the elections, what will be the decision. So how will that impact all this, and what restrictions will be required, and how everyone can observe that? That becomes important. And now that it has become more or less clear that the imposition of lockdown or whatever it is will not be from above, it will be left to states and districts and areas. How would that be implemented? How tight would that be? What facilitations need to be provided, taking into account the problems of people? That becomes important. Also preparing doctors, medical workers, that also becomes critical. Now, there is a reference about the number of doctors available per 1,000 population. There are some parts of our country where it is very good. There are various other parts where it is not all that good, whether it is doctors or medical workers. Also, important would be how to provide food for people. Again, the Kerala model talks about food kits being provided to large number of people, so they were not too concerned about how to continue with their day-to-day activities. Panic buying needs to be avoided. So how would that be prepared? The courts have been talking about the one nation, one ration card principle. Has that become effective, and will that reassure people that it will become available? Will they be able to come out and get their ration, and what would be the arrangements for that? These become important. But there are other medical issues, again, handicapped people or differently abled people, people who are alone, people who are senior citizens. How are they to be helped in a scheme of things like this? When there is no employment, how do we ensure earnings for such people who are dependent on day-to-day arrangements? Also, what has become clear so far is strategy will have to be different for different places. There is no one uniform strategy which will be laid down. So depending upon the cities, areas, different strategies will have to be adopted, and that will also have to be worked out. And in that, what has to be kept in view is, while on the one hand we try to achieve the purpose of the objective, at the same time how to reduce inconvenience to people, minimize inconvenience to people, that will have to get inbuilt and people should come to know about it. That becomes important. And I suppose from the state level it will now travel down to districts or city areas and groups of villages or villages, so that it is better administered and local requirements are taken into account, at the same time keeping the larger objective of avoiding spread of the pandemic. Another point which would be relevant at this context would be, since very many people are still concerned as to whether the vaccination drive will continue, whether one should still continue to make efforts, whether that will continue or not. If that is to continue, what is the regime which would become available, so that people do not get panicky about when do I get my first dosage or when do I get my second dosage. That becomes important. That message also has to travel down clearly. Here, the voluntary organizations, those who are working in the society, will have to play a very key role. Also important would be the scenario regarding educational institutions. Will they be functioning? Will they not be functioning? If there are options available, are the options readily available, right up to the remote level where probably connectivity may not be all that good? How long will they remain closed or open? Admission process, all this become important at this particular stage. Another point which has come up is the psychological help which is required for a good cross-section of people. Are we prepared for that? Has that got built into the scheme of things? And that's again important because it doesn't come to light, or it doesn't get highlighted to that extent. There are a good number of people who require help, and how is that going to work? What is the mechanism again which is going to be put in position? Moving on to another area which could be controversial, but I think it is critical. How do channels and media play their role? Quite often what we see is that I am the first to report, I am the best to report. Moving out of that, how do we have a regime whereby the issues are highlighted, focused, the best medical opinion, rather than have the extremes of medical opinion? The best medical opinion in the interest of people becomes available to people, and the channels contribute to the process of people getting ready better, rather than the panic situation going up and that leading to, I'm sure there are very many people who say that I don't watch these news reports because it is alarming. So let's have a regime where channels, print media, everyone adopts an approach that it's not a question of publicity, or it's a question of not a question of TPR and things like that. It's a question of serving people. How best that can be facilitated. Again, some sort of self-regulation or so will have to come into play. What has also become important is an active role for the society. Now, it's not enough to say that the administration will do everything. How to involve society? Again, there are lots of instances where society has come forward to play an active role. They played a positive role. Very many places it has been facilitated. Even with vaccination, that becomes important because they can play a key role. Whether door-to-door vaccination is possible, what advanced information can be provided to people so that they don't really have to try to find out whether my turn will come or not. Simple things like wearing of mask, keeping distances and things like that. There are very many lessons still to be learned. As a reference was made, little bit of relaxation, everyone thinks that one can move around happily. That is not the scene, and how best to observe that. So how can others come into the scheme of things so that people are continuously educated and alerted about what needs to be done? And the last point I would like to make, of course, is the impact on the economy. It's not a simple point to make, but we have to take that into account, because after some time, probably the reason why relaxations come into play or people tend to ignore is that it's a question of earning livelihood. It's a question of contributing to the process of production. And ultimately, there is an issue about, everyone talks about 12-month period, GDP impact and things like that. So these become concerns for how best that can be addressed. If we can be sure about a short period, one can be better prepared for a short period, but I don't know whether medical experts would say that it's possible for a short period. But a short period of a third wave can be thought of if we all observe certain requirements and we adhere to that, and that is well known to people. So this type of communication also would be important. So my point would be, yes, good that these points are discussed, but beyond this, learning from the experience of those who have done well, those who have handled difficult situations, what more needs to be done? that probably should get concretized, and that could get spread to all across the districts, cities, villages, so that everyone is prepared. And probably, if it is possible, one can have a mental feeling that, yes, I have to do this for this many weeks. After that, probably will be in a better position. Thank you for this opportunity.
Well, thank you so much, Dr. Ramachandran. It was, in fact, you have hit the nail right on its head by bringing up a few points, both from the perspective of the urban local bodies, the state government, as well as the central government. And in fact, the next session, we will have the pleasure of your participation and listening to and adding more to the 8 cities who are participating from all across the country, including the MCGM, the most talked about Mumbai model. I agree with you that you need to have political will. That saves a whole lot of unnecessary expenditure. The local self-governance empowerment, this is something which has actually shown a whole lot of results around this time. If this was not the case, then probably we were still talking about, a central command and whatever goes down at the level. So that's the reason as to why it was left to the states to decide whether you require a complete lockdown, a partial lockdown, or whatever it is for that matter. And epidemic preparedness, I mean, we have all kind of acts, the Disaster Management Act and so on and so forth. The post-disaster management is something which everyone does. So what is it that needs to be done? Pre-disaster management, that means the entire infrastructure needs to be augmented, both with the governmental as well as the non-governmental setups. So that means the involvement of the community, the involvement of the institutions working at the grassroots level. Everybody needs to come together, and that is something which has been a great learning during this time. And important part, which is what you also mentioned, is about communication. Now that's a double-edged sword. Now government is communicating one bit and media is communicating another. So when we talk about media, it always becomes a devil. They always show the dirty images rather than saying what is good. So it reminds me of one instance, if I may share here. There is a very popular YouTube media channel called Lallan Top. It works along with one of the mainline media channel. And during the time when Kanpur reported there were only 2 deaths in a day, their entire team was out all of night, and they were only counting the number of bodies lying only at one crematorium, and that exceeded 50. So that means to say that what is it that the state government is talking about? Are we hiding numbers? And then the media comes in with its devil side of it. If the government is saying that the vaccination is up, so media is now getting very, very encouraged and talking about increase in vaccination, the preparedness, so on and so forth. So probably communication also is an important instrument and tool from the government side to the media and to the people directly. And the wire media in between happens to be only either the print or the electronic. Yes, this is a double-edged sword. So you have actually pointed out something very, very pertinent here. At this juncture, I would like to invite the state of Haryana, Mr. Prabhjot Singh, who is the MD NHM. Mr. Rajiv Arora has been pulled into some another meeting. So with this, we would like to take this discussion forward, certain points raised by Dr. Ramachandran, and let's seek an answer to it.
Thank you. I thank SKOCH Group. It is my privilege to be here. Sir has been called for another meeting with Honorable CM. I have listened to what my previous speaker has said, and I would be restricting my talk on preparedness to third wave in Haryana state. I will be giving a very short presentation on this. Next, please. So this is the Haryana status at a glance. We have tested so many samples, and around 768,000 have been found to be positive. And one of the best thing is that our RT-PCR is to antigen testing ratio is 75 to 74 is to 26, and which is more than the recommendation of Government of India. Government of India says you have to test more than 70% RT-PCR. We have 44 labs, total labs, and we have a testing capacity of 110,300 samples per day. At present, we have 1,380 active cases, and home isolation cases are 578. We have vaccinated around 90 lakh of our population in Haryana. We have a cumulative positive rate since the corona started, that is 7.65%, and the present positivity rate of 1 day is 0.24%, and recovery rate is 98.59, and fatality rate is 1.23. So these are basic indicators. Next, please. This is the geographical distribution of cases in all the 22 districts of Haryana. As you can say, the cumulative positivity rate 7.65%, and some of the districts like Faridabad was having a cumulative positivity rate of 10%, 10.77, Gurugram 10.92, and then Hisar 8.76. But if we talk about daily positivity rate, then there is only one district, that is Palwal, which is showing 4.55% daily positivity rate. Next, please. So this is the trend of district-wise comparison of positivity rate and samples that have been tested. And as you can see, the positivity rate is coming down steadily. Next, please. This is the comparison of peak of COVID-19 first wave and peak of COVID-19 in second wave, and today's comparison. Like in daily cases in the first wave, it was 3104 at the peak. In the second peak, it was 15,000, and now we are at present at 85 daily cases, new cases. That's on the peak first wave 25, in the second 153, and now we are sitting on 50. Daily positivity rate, you can see, community positivity rate, sample selection, you can see. Next, please. So this is the overall picture of Haryana state. As you can see, in the first wave, there were 2 small spikes. In the second, there was a huge spike on 4th of May, 15,785 cases were reported. And now the spike is down. And now we are going to prepare for the upcoming third wave that is being proposed. Next, please. Regarding genomic surveillance, as you know that Government of India is having a genomic lab where we are sending our genome samples. At present, Haryana does not have any genomic lab, but we are going to open it very soon in the PJMS quarter. Next, please. Next, please. Next. So we have sent 3118 WGS whole genome sequence for the testing for the central surveillance, and 973 of these have been processed by Government of India, and 658 samples in the 658 samples mutation have been found, and the Delta Plus variant, which we are talking these days, has been found in 1 sample tested at Faridabad. Next, please. Next. If we talk about district-wise surveillance, then Delta Plus variant is found in 1 Faridabad district, and Delta variants have been found in 163 total cases have been found for Delta variant. Next, please. Now we talk about what addition we have done in infrastructure side. In the infrastructure side, if we compare, in January we didn't have any oxygen plant, PSA plant. At present, we have 11 that are functioning in our district hospitals: Sonipat, Ambala, Faridabad, Hisar, Panchkula, Karnal, and we are augmenting it constantly. We have ventilators, there are 477, oxygen concentrator 3,757, including 1645 oxygen concentrator are given by Government of India recently. BiFAP 572 hydronasal cannula. We have 110 oxygen cylinders, which were in huge shortage when the second wave was at the peak. We have now 2,866, and we are procuring more oxygen cylinders. B-type cylinders, we are also procuring more. We have 6,155. 82 ventilators are available in warehouses. We are going to send them in the districts, and PSA plants, as I told you, that they are functional in these places. Next, please. So in the PSA plant, if we talk about them, we have 300 LPM plant in Panchkula, 200 LPM plants Karnal, Ambala, Sonipat, Faridabad. In the second phase, which is given by HITE, CMSS, and DRDO, 16 DCH will be covered, 11 SDH sub-regional hospitals, and 7 medical colleges will be covered. And these, at some places, the CSR and the CSR various companies are providing us the PSA plants for oxygen. Next, please. Regarding GY, Government of India has provided 6 existing PSA plants, and 34 they are going to provide more. All the district hospitals, medical colleges, and 11 sub-regional hospitals and CHCs will be covered by Government of India. Next. And HMSCL is also going to put 139 more PSA plants. And we are hoping to cover all district plants, SDS, CHCs through PSAs. We have also issued orders for private hospitals also, that those hospitals which are registered under the Hospital Registration Act, 50 bedded plus hospitals, it has been mandatory by the Haryana government that they have to install PSA plants in their hospitals as well. Next, please. Regarding liquid medical oxygen tanks, they are in place at 6 places. Gas manifolds were set up in 2021. In the year 21-22, facility of gas manifold and oxygen pipeline is being extended up to CLC level. Next, please. So this was regarding oxygen, regarding PSA plant, oxygen concentrator, gas manifolds. Haryana government is taking it very seriously, because in the second surge we have seen that oxygen was a rare commodity. So we are working very hard on this. Regarding other logistic items, if we see triple layer masks, they are available in good quantity, and 95 masks, PPE equipment, antigen kits, they are available. Next, please. Now, some of the drugs which were in scarcity during second wave, we have already procured. In Remdesivir, we have 1,24,000 in our stock. Tocilizumab, we have 210 doses, and we are going to procure more doses. Amphotericin, we have 819 doses. Government of India is going to give us 4,000 more amphotericin doses very soon, and we are procuring it on our own also. These are some of the drugs which were in huge scarcity during the second wave, and we are making sure that in the third wave we have sufficient stock of these drugs beforehand. Next, please. Regarding molecular testing labs, RT-PCR labs, we have government labs 19 in January, and in May we have added one more. In the private sector, we have allowed 22 private labs, and now we are going to establish 7 more government labs in the districts of Kathal, Kurukshetra, Faridabad, Palwal, Narnaul, Jhajjar, and Jaki, Dadri. Very soon, in all the districts of Haryana, there will be government lab. Next, please. We are going to procure more ambulances. We have issued indent of 26 advanced life support ambulances, 60 neonatal ambulances. We have issued indent to our procuring arm HMSTL. We have issued indent for 47 mobile medical units. We are about to receive 188 patient transport ambulances, and we have already received 44. 100 will be received in this month, and rest 44 will be received in next month, and others will be having a good fleet of ambulances in the very near future. Next, please. Regarding the pediatric wave, everybody is saying that as the next wave will be a pediatric wave, and we should be prepared with respect to pediatric cases also. So this is the kind of pediatric projection that is given by Government of India. That if we say on the 4th of May, we have a maximum cases peak at 15,786. So 12% of these confirmed cases were children less than 20 years, 1894. 90% will be under home isolation. Although this hypothesis, our government is saying that 90% with respect to kids, if we say that people will not agree for home isolation and they will rush to the hospital only. Honorable CM and the ACS and Health Minister, they are saying that we should revise these, and we should assume that because in the Government of India projection, they are saying that only 2% of these cases will require STU ICU admission. But we are assuming that around 15% will require STU ICU admission, and over 20% cases will be admitted in hospitals. So we are revising these numbers for Government of Haryana. These are the projections that are given by Government of India to us. Next, please. With respect to these assumptions, only what pediatric beds will be required, that is 947, and ward beds that will be required 568, ICU beds that will be needing as per Government of India criteria 379. Next, please. At present, we have 409 beds in 24 SNCUs and 294 beds, pediatric beds in 22 district hospitals, but these are with respect to the health department only. We have many beds in the medical colleges as well as in private sector. We are gathering the data of private sector as of now, and accordingly we will be augmenting the pediatric beds in health department as well as medical colleges. Currently, we have 170 pediatric ventilators, 482 BiPAP, 103 HFNC high flow nasal cannulas for pediatric use. 82 ventilators, as I already told that they are available in our warehouse. We have around 13 contractual and 54 regular penetrations in the state, and we are going to do more in the near future. Next. Regarding mucormycosis, as we have seen that this black fungus that has come as a big surprise, and there have been discussions of its reasons that the people who have been infected with COVID-19 and having diabetes, and they were on steroids, and mucormycosis was going to happen to them. And mucormycosis main reason is diabetes and steroids and COVID-19 because it decreases immunity. But then there are discussions on oxygen also, that because industrial oxygen was diverted for medical usage, that was one of the reasons. And many studies are going on right now why mucormycosis happened. As far as Haryana position is concerned, then we have distributed 27,000 injections to private hospitals and government hospitals also. And the government of Haryana has set up a committee which used to analyze the cases on a real-time basis. Even at midnight, they used to do WhatsApp to one another, and they used to decide whether the patient needs an amphotericin B injection or not. If the person needed the injection, then they supplied the injection immediately to the hospital. And we have distributed to 27,000 injections at the rate at which the government of Haryana had got to the private hospitals. And for the government medical colleges, we have made available these injections free of cost. Next, please. Regarding the steps taken to control mucormycosis, we have declared it as a notifiable disease, and all the people they had to report these cases to Government of India. Technical committee, as I told, that has been constituted. 5 medical colleges have been notified for this treatment of mucormycosis. We have given detailed trainings to our physician, ophthalmologists, ENT surgeons, dental surgeons, and we have sensitized our healthcare workers and caregivers about the proper usage of oxygen and steroids, and we have given newspaper advertisements and social media messages also. And as I told, that injection and amphotericin B was free of cost in government institutions, and at the cost at which we got, the government got, we have provided the same to the private institutions. Next, please. Regarding COVID vaccination, I must say that Haryana is one of the states which has only 2.04, 2.05% of the population of the entire country, but our space is one of the topmost in the country. We have vaccinated 90,000 of our 90 lakh of our population, 90 lakh 36,000. Second dose, now our emphasis is on second dose, because the second dose wise we are somewhere lagging behind. Only 14 lakh population has been given second dose, but our emphasis is on second dose only. Some of the reasons for delay in second dose is that Government of India initially had fixed a timeline of 4 weeks for Covishield, then they increased it to 6 weeks, then they increased it to 12 weeks, and thereafter there was another protocol that those who have got COVID in between, after the first vaccine, if they have got COVID, then they can relax for 3 months. So with respect to Covishield, there were multiple instructions, and that is why the COVID software was amended accordingly. And one of the reasons is that only. And we are trying to maximize our second dose. And our pace, I must appreciate our healthcare workers, our doctors, our CMOs. Our pace is one of the best. We are vaccinating at around 1.5 lakh people on a daily basis on an average. Next, please. So this is our pace. In January, we vaccinated 1,21,000. There was hesitancy at that time because only healthcare worker and frontline worker were open till February. But you can see in June, we have vaccinated 27 lakh people. In July, only on one day, we have vaccinated 1,85,000 people. Next, please. With respect to allocation, if we say the Government of India is allocating around 21 lakh Covishield and 4 lakh Covaxin to us, and in the private sector also. This includes private sector also. Government of India is giving 25% to the private sector also. Next, please. Regarding home isolation kit, I must say that Haryana is one of the few states who have taken care of the patients who were admitted in their home isolation. We have at one time around 70,000-80,000 patients in home isolation, and our teams used to call them on a daily basis. And on every alternate day, our teams used to visit them to monitor their vitals. And we have made a very, very nice kits consisting of what you can say is digital thermometer and a steamer and a pulse oximeter and some medicines of Ayush department and some medicines of allopathy also we provided to the home isolation patients. Overall, we have distributed 35,900 kits, and preference was given to the people who have been in the first week of the home isolation. And in the anticipation of third wave, we are already making efforts for 10,000 kits to be readily available, and they can be supplied within no time. Next, please. Regarding another scheme of Honorable CM that was launched in Haryana, HPG-NCS Haryana Villager General Health Checkup Scheme, we have scrutinized around crore 73 lakh people in Haryana, in all the rural areas of Haryana. It was scrutinized, and all the people who had some kind of symptoms, they were tested. And and there was some kind of discussion going on that corona has spread to the rural areas. But we found during these screenings and house-to-house screenings were done, and in the ambition board screenings were done, we found only 7,000 people were infected. Now we have developed the home isolation centers in the villages also, and isolation centers in the villages also, and we gave the medicines also, and fortunately there were no deaths that we have seen in the rural areas during the HVHCS scheme. We have seen this thing. The 1,10,000 people of ILI were detected, and they were tested through rapid antigen kits, and the RT-PCRs were also done. Overall, I can say that around 6,000 to 7,000 people were found positive. Next, please. These are the pictures of village isolation centers that were created for the villages. Next, please. We have started providing training to our pediatricians, anesthetics, medical officers, and staff nurses. We have started a new program, social awareness and action to utilize pneumonia successfully for the kids, and we have started trainings for these also. We are going to sensitize our ASHA workers for the proposed upcoming third wave, and government players also going to start the training for healthcare functionaries. Next, please. Next, please. We have provided around 1,133 different kind of people HR to our CMOs, consisting of epidemiologists, public health manager, microbiologists, physicians, specifically for the COVID purposes. They were provided good salaries, taking special permissions from the government, and you can see district-wise around 850 were sanctioned in the last wave, and 283 are sanctioned in this wave. So overall, we have provided 1,133 people of different types. Next, please. Thank you. Any questions from anyone? I'll be very pleased to answer. Thank you.
Well, thank you so much. I guess we'll come to the questions during our discussion, which will be immediately after I invite the next speaker. So from a practitioner and author of Bringing Government and People Closer, Dr. Ramachandran's perspective, and from a state perspective presented by Mr. Singh, it's time to move on to an economist's perspective, Professor Amirullah Khan, Research Director, Center for Development Policy and Practice, Adjunct Professor at MCR HRD Institute, Telangana. Professor Khan is a former civil servant from 93 batch. He currently teaches at Law School in Hyderabad, Indian School of Business, and IIFT. He has worked on various research projects for the European Commission, NCAER, Planning Commission, and the World Bank, and the list is endless. Professor Khan, please unmute yourself.
Thank you very much, Gulsharan. Thanks for inviting me. It's been a scintillating discussion so far, and I hope I don't take away from that. So, it was really wonderful to hear these 2 points of view, and earlier in the inaugural session. Thanks for inviting me. And I think that that as always, you at SKOCH have been prescient in starting the discussion on issues that we otherwise would have postponed till they happen around. So so it's so apt to start with this with the topic that you have announced, which is preparing for the third wave. And I hope that we take this seriously and don't end up with the same problem that we had with phase 1 and phase 2. God alone knows how badly prepared we were for both the issues. So in my short intervention, I'm going to talk about 4 broad issues that I would like to place before this absolutely wonderful audience in what I propose through SKOCH that we do purely from a healthcare and a health sector perspective. The first point, and this is a point that I want to make very clearly and very loudly, and this comes from everything that we teach in our economic policy classes, or particularly our health policy classes. And that point is that in healthcare, there is no half full glass. You see, you can do this endless debate on glasses being half full and half empty everywhere else, but not where lives matter. So it is irrelevant to talk about what has been done. If you do a record some million vaccines on one day, that is not the relevant fact. The relevant fact is how many have been not done. It is not enough to say, one dose has been given to 30% of the population. The important thing is to say how many we haven't got second dose. So therefore, in healthcare, there is no patting ourselves on the back and looking at half measures. That is the first issue. And in that, the 2 points that I want to make within that is look at the situation right now. How many of us are even now clear about whether this vaccine issue is a state issue or a central issue? I mean, haven't we gone around this for too long without making it clear? Even now, we don't know. I mean, it's gone back and forth so many times. But who is responsible? Who will be held accountable for the third wave? I don't know. I think it is time that, like with any policy making, we fix the responsibility, and somebody has to be accountable. Some head should roll, at least in the third wave. It did not in the first and the second. The second point, within this first issue of the policy, are we clear as to whether vaccines are for free or are they paid vaccines? Who will get the free vaccine? I mean, it's still very unclear. And somewhere it says that all above 18 will get it for free. Somewhere it says you go and buy Sputnik. And where are we on this issue? Point C in that, which vaccines? Are we going to get a Pfizer? What is happening with Moderna? When will it happen? I think we need clarity on this yesterday. The second point I want to make is the issue on our investment. Our investments and our sincerity in vaccine research. If you look at, I tried looking at what we as a country have done as far as vaccine research is concerned. I could get a lot of material from across the world, but the only thing I got as far as India is concerned is that ICMR has spent some 46 crore rupees in field trials. There is nothing else that we know about. This was a figure that came in May 2020. After that, are we doing anything? What is our spend? What is our vaccine research strategy? Are we doing enough sero surveys? And you get to know now that Mumbai has 45% children who have antibodies. Why can't we have that for the country? Because, several epidemiologists are telling us that it is children who are at the forefront, right? Children who are most threatened. And therefore, we better get those surveys done very quickly. The sad story of genome sequencing, despite being now becoming notorious for having produced the variant that is ravaging even Africa, there is nothing that we have done as far as genome sequencing is concerned. The abysmal and the pathetic numbers that we quote are enough of an indictment. And we need to do that for ourselves because we need to follow the variants that are coming up within our country. The third point is, and flows from that, is the entire point of data. Why is it happening that we are constantly getting information that the actual number of deaths on the registration, on the CRS data is 3 times or 4 times or 5 times the number? Look at the Kerala example. Again, we keep quoting the Kerala example. Here again, it comes up so shining bright that Kerala, when the government gives out the data, it's not leaked out by some journalist from somewhere, then we get a very refreshing figure that the actual number of deaths in 2020 is 10% lower than 2019. That's what happens if we bring out clear data to 2,37,000 deaths in 2020, 2,63,000 deaths in 2019. And it makes sense. The death rate in Kerala, particularly, look at the accident rates. I mean, there's actually a decrease in the death rates due to accidents from about 4,500 to 3,000. And it stands to reason when we have locked down everything, people better not die on the road. then it means that we haven't locked down properly. So, and if we look at the Kerala numbers, again, one of the highest prevalence, nearly 10 lakh confirmed cases now, but 3,700 deaths, 0.4%, the lowest in the country. Once we look at this data, we are able to then understand what is going on. And it is important for us to get this data out state after state, not hide it. It only makes things worse. The final point that I want to make on in this intervention is that if we are going to get ready for the third wave, it doesn't serve anyone's purpose to keep highlighting what the citizenry is not doing. This is a policy issue. This is our problem. It is not about complaining that people are not wearing masks and are going out without maintaining social distancing. They're doing that because we are allowing it. If we don't want that, let's lock down. We cannot be complaining about vaccine, about dosages by saying that people are hesitant to take vaccines. When people are hesitant to take vaccines, it's a policy problem. The incentive and the disincentive that should accompany vaccine hesitancy is a policy issue. We did that with polio. We have to do that again. A problem has to have a solution. And in the vaccine hesitancy, the simple solution, and stares in our face, is supply. Where is the supply? And how are we going to tackle the vaccine issue by constantly worrying about where the next vaccine consignment is going to come from? Even now, procurement systems in every state, every district, I can tell you about my city of Hyderabad, which has done fairly well by way of vaccine, among the highest, is still not sure about tomorrow's vaccine collection. Each one of the centers cannot promise people that you can come back on day 3 and get vaccinated. It's your chance. You come every day and try and get a vaccine done. That's the important reason for hesitancy. The important thing is therefore that on the vaccine issue, we must acknowledge that it is a supply problem. It is not a demand problem. It will become a demand problem much later when we go out into rural areas and so on. Right now, it is purely a supply problem. So Gulshan, those were my 4 interventions. I wanted to emphasize that we cannot be happy with half full glasses when people are dying. We have to invest in vaccine research. We have to do our genome sequencing and our sero surveys and our tracking and tracing. That is one thing. Thankfully, the Prime Minister himself pointed it out yesterday when he acknowledged that Arogya Setu was an app that had contributed significantly, but we've lost sight of it. We don't even talk about it. He was the only one who spoke about it in the last couple of months. We have to go back to doing serious tracking and tracing because the third wave is going to be a different animal altogether. The third point that we have to get rid of our data hesitancy. We have to give out our data very clearly, very openly. You cannot have Bharat Biotech not giving out its third phase data even now. And finally, the issue that vaccine hesitancy is not a consumption, is not a client-related problem. It is a problem of supply. Thank you very much.
Thank you very much, Professor. It was very interesting. In fact, raises a whole lot of questions. I'm going to save them for the discussion.
Thank you.
In the meanwhile, in fact, you have raised, if I go back to your submission, quite a few things I would like to ask Dr. Ramachandran as well. But before I come to the part, let me invite Dr. Shefali Das, Distinguished Fellow, SKOCH Development Foundation and former Director General, National Informatics Center. She is a specialist in planning and implementation of MIS, in decision support system. So we have a techie who's going to be looking at, this, so to speak, technology-led interventions, because this is what we've been talking about since morning, that without digital interventions, nothing is going to be possible. Professor, you talked about Arogya Setu, and that also happens to be one. But there are reasons, which is what we would like to find out as to why the popularity has gone down and only Prime Minister is left talking about. So Dr. Dash, she has been instrumental in implementing a large number of projects, including Rajiv Gandhi National Drinking Water Mission, Community Information Centers, wide area networks, so on and so forth. So with this, I invite Dr. Dash for her comments. Shefali, you need to unmute yourself.
Yeah, thank you, Dr. Gucharan and Mr. Samir Kochar. I must congratulate you for bringing up this timely discussion today, because this is the time when everybody is actually wondering, worrying, and speculating about the third wave. And this is just right time to discuss about that. One more thing, just before starting, I would like to say, though I am a technocrat by profession, this pandemic is not really a technology issue as such. It's more of containing, managing, and curing people. So I may not be actually emphasizing on technology aspect, though I'll be just lightly touching on that. So basically, the way things are moving on the ground and estimated by the experts, third wave of the pandemic is inevitable. Whatever we may say, whether it is a localized third wave or all across the country, like Dr. Debroy said in the morning, irrespective of that, there is going to be some surge all over the country, maybe in different phases or maybe different timelines, but it is going to come. But whether it is going to be more virulent than the last, whether it is going to be more infectious than the last, is something which we do not know. In fact, nobody knows, because everybody is only speculating, because enough data is not available. So now what we think, I mean, at least I feel, it's my personal opinion, that most of it will depend on the public behavior. We can't do stop the mutation of the virus, that is true, but what we can stop is we can prevent it coming and affecting us in unexpectedly, like it did in the second wave. Because that time we all thought, okay, the pandemic is over, started going to a holiday and having get-togethers, marriages, everything went on. We have Kumbh Mela, we had elections, we did have everything, because we thought it's all behind us, but actually it's not so, and it's not going to go away in the next 2 years or so. We have to accept that fact, and we have to learn to live with those boundary conditions. So what we have to do is that we do not have enough data, so we don't know much about the virus. We don't have much scientific papers also. The papers which are coming are based on very small subset of data, or data which is very localized. Like we do have 60 odd cases of data plus, and what can we infer on that? We are trying to do, but it is not enough. We can't really predict anything. We don't know whether the children are going to be more affected this time than the second wave. And these are all thinking. But what we can do is we can protect ourselves, and we can ensure that we at least we should not be not taken by surprise. And I have got few suggestions which because experts have already spoken a lot of things about that, but my few suggestions are like this: that we had gone for lockdown, the first nationwide lockdown. That is very important at that time, because we didn't have health infrastructure at that time, and we had to somehow stop spreading. That way it was all right, but it also gave rise to a lot of economic crisis. Our economic health really got down, employment got reduced, a lot of people lost their jobs, migration of laborers and outside immigration have, going back, all that not only lost their livelihood, but also created a lot of infection spread, because people from one place went to the other, they went in hoods, they went in groups, in the crowds, all these. This has led to a lot of issues. So but that was necessary at that time, because we are not prepared. Second wave, we saw migration happen, but it happened much lesser, because that time we are also a little more aware. People knew that, okay, if we don't go, if we stay where we are, maybe the state is going to supply us with rations, which the government is doing. Up to November, up to Diwali, free ration is being supplied. So some intervention is there, and people are now aware that this intervention is going to happen. So the migration is much less this time. Economic distress is much less this time, because also we learned from the first one that We cannot go to the shops, we cannot go to markets, so e-commerce sites have come up. A lot of innovative ideas have come up. We did have Swiggy, Zomato, everything. But that time you have to order food from a particular shop or a restaurant. Now they have come up, Swiggy, Zomato, all of them have come up with a solution. Like if I want to send food to somebody within the city, I can use their services. Not only food, I can buy medicine, or the shops can send medicine through these services. So these are, in a way, these are also technical interventions, because it all happens through some kind of a website and information gathering, all that. But we have learned that. So what I feel now it is more important is we have to, instead of going for big lockdown, state-wise, district-wise lockdown, we have to go for micromanagement of those infected areas. Because if the virus is going to be more infectious and we shut down a smaller area, it may, and then not only shut down, identify the smaller area, but also provide support, logistic support, food and essential supplies to them, then they will also not get deprived or not feel the need to go out by defying the law. So not only we have to make laws, also we have to make provisions so that those laws can be adhered to by the people without going through much distress. So that is very important. And second thing is community participation. We cannot think that for everything we depend on the government. Government will do this. No, that doesn't happen, because here we have to protect ourselves. So the community, and we have seen in the last two waves, we have seen where community participation was encouraged, people were much more protected. They felt good about it. Food was supplied to the doorsteps, whether they pay or state pays or somebody else, NGOs pay or whoever pays. That's a different issue. Point is, they don't have to step out of their houses, so the infection doesn't spread. That is, community participation is very important, not only for supplying, also for creating more awareness. Like we have been hearing in the morning, people think that, okay, second wave is over. In fact, if you see all the holiday destinations nearby Delhi, Uttaranchal, Uttarakhand or Himachal, even Haryana, Rajasthan, all the holiday resorts are booked. Hotels are fully booked. You can't book anything for the next 2 weeks. So you go next week, you'll find the next 2 weeks, you don't have anything. So people are getting suffocated and they want to go out. But that is not the right behavior. We have to be, all aware that this is not the way things will go. What is there? A person lives for about 60 years, minimum, say life expectancy about 60 years. If 1 year we have to be a little more restricted and protected, how does it matter in the whole span of life? So that is one thing. Third thing is peer pressure. We have seen a lot of vaccination hesitancy in people. And political leaders, religious leaders, they play a great role, all right. But more than that, peer pressure. I just give a small example. I have a driver, I have a Mali, and I have a household help. Now, the Mali is a part-time worker and he works in some office. All three were not interested to take any vaccine. They were saying, oh, bukhar hoga. So I will have this problem, that problem. Isko ye hota tha, usko wo hota tha. And they were not ready. The Mali, where he was working, the workplace, he got vaccinated. And after 2 days, he came to work. After seeing him, my driver went for vaccination. My maid went for vaccination. So what I'm trying to say is peer pressure, like you tell, I tell, the elders tell, may or may not be so important. But if my friend takes it, I'll be, encouraged to go and take it. So that is why we all have to play a role in making people understand that yes, vaccination is the only solution which will give us some kind of a herd immunity. Whether it is 100% immunity or not, that's a different issue. But at least we are, even if we are 50% protected, that is 50% life saved. So we have to think about that. That is one side which everybody can do. Beyond that, what we can do ourselves, because we have to prevent ourselves from getting exposed and infected and getting sick. So how do we do that? Masking and all, social distancing are all right. They are good. But more than that, I feel we should all get vaccinated, number one. Number two, we must encourage everybody around us get vaccinated. Number 3 is we should avoid, crowded places. So that how do we avoid it? We don't go shopping too much because things are available most of the places. Even Amazon goes to my little village in Western Orissa, which you won't find that village in any map, but Amazon supplies them. So that is how technology has gone. So that is thing, and people are still now. They have started getting invitations for marriages, for other functions and all that. We must promise to ourselves neither we will hold such meetings nor we will go and attend them. So that is one kind of a deterrent for stopping those. So these are the things. I will touch upon the technology part because otherwise, good Sharon will.
Oh, this was actually very nice because, the point that I'm driving home from here is essentially the self-restraint and the importance of IEC at the state level. Well, we'll take this discussion forward. In the meanwhile, let me move on to invite our expert on credit, financial inclusion, and skill development, Mr. Madan Mohan, a senior fellow with Scotch Development Foundation and former CGM NABARD and CEO NABARD Consulting. He works as a consultant with Ministry of Agriculture and is a faculty on Institute of Agriculture and Business Management and NIBSCOM. Mr. Madan Mohan, bringing in the perspective from the credit and the financial inclusion side, the hit that these areas have been hit by COVID. Please unmute yourself. Mr. Mohan, you are muted.
Thank you, Dr. Chandal. And friends, it's my pleasure to be here. I have been listening since morning, and I find some very good suggestions have come. And I would also like to share my experience and my feelings about the issue. Now, some people are telling that third wave may come, some say may not come, some may say that it may come earlier than predicted. But my dear friends, let us accept the fact that coronavirus is there and it will remain there, whether you call it first wave, second wave, third wave, or maybe another waves may be there. Name may change, but the fact is it is going to remain in our society. So the whole issue is how best we manage it and confront with it. See, very good strategies have been indicated by various speakers, and I have also pinned down those things, and I feel these are also very, very important things which we should consider. And according to me, the most important thing is, or the challenge we are facing is, how do we ensure COVID appropriate behavior? See, I am telling you from my own experience when I go out in the market these days, sometime to buy some vegetables or fruits, I find in my area, I say out of 10 people, at least 8 people are not wearing masks. Those who are selling the goods, they are not wearing. Those who are just going there, they are also not wearing. So, and there is a question of social distancing is out of question. So they are not observing. So one feels very scared and sometimes odd also that you are the only one who is wearing the mask. So the most important thing here is how do we create awareness about this, that it is important to observe these two things. Now, unless we involve local people, as have been rightly said by other speakers, and local leaders, even spiritual and religious leaders. Now, this has not been done in wave one and two. Let me tell you, even our people, police going to mosque and telling that please observe, and even so the type of gatherings which we have allowed on various dates, that is, awareness creation was not there. So my dear friends, if we want to confront the third wave, we have to see that common people, as rightly told by other speakers also, that people have to be communicated and convinced. Because as of now, communication is happening through various medias, but people are not convinced. If you just talk to them, he says, well, where is the COVID? It's all humbug. So those things have to be, they have to realize and accept it. No, in financial inclusion, why did we succeed? Because we brought a concept and we made people to feel, have a felt need of that thing. No, there should be a felt need of that, yes, we should have masks. Yes, we should follow the appropriate distance. So the role of local leadership is very, very important. Now, another thing is about adequate health infrastructure that everyone has told. I will not I will not deal much upon that. The Haryana case is before us, where they are providing better infrastructure, and that has helped in really containing the COVID. But the only thing is that the local strategies are going to be very, very important, because from center you can't push anything. And number of cases are before us, that states, and even in state, because I have taken number of presentations from different parts of the country, and I know some of the DCs, DMs, they have done exceedingly well without instructions. Even they have gone at their own, with their own initiative, they have brought the changes and handled the scenario in spite of various constraints. So this is what is required, and that only happens when decentralization takes place. Now, another important role which I need to highlight here is role of media and even social media. See, lot of rumors are being spread. Now, how do we ensure that in third wave this does not happen, or how do we really check it? Because most of, still, if you talk to some people, they say if we get vaccinated, we'll die, we will become impotent. Somebody will say something else will happen. See, all these things are being spread by media. I mean, social media, and even our media, so to say, TVs. They, as rightly pointed out by earlier speakers, that they are reporting extreme cases, or they are reporting only special cases. They are not highlighting. They are only highlighting a particular community. So those things should not happen. And that, if we really want to tackle the third wave, we have to see that we keep a check on this. Another thing I want to highlight here is that there is still a corruption element. So how do we, though there are only very few cases which have come to light, but we do not know whether it is with regard to saline injection or injection being not given, or even giving spurious drugs. See, all these things, what is the penalty for that? Unless we really see that there is a fear in the mind of the people that yes, they are doing harm to the community, that needs to be checked if third wave is to come. And lastly, I would like to say uh, that if we are not ready for the third wave, I think Corona is already ready and waiting for us. So we have to see that we are there before him. Thank you very much.
Well, thank you, Madan Mohan Saab. This is again, totally a different perspective. If I put three perspectives together, I can see, I actually had a few questions to be asked from Haryana. I don't see Mr. Singh there on the screen. Let me ask Dr. Ramachandran, what from this discussion I've been able to gather that if the first wave was centrally implemented, executed by all the states, so it was a law and order situation. what probably the last two speakers talking about is it also happens to be a capacity building and an information education and communication IC problem. And on top of that, there is infrastructure, and then the rumors that this vaccine is fake. Certain issues which Professor Amir talked about, whether it is the responsibility of a state or a it's kind of a muddle. So, Dr. Ramchandran, if you take a bird's eye view, how does it appear from top, and possibly how can we put those pieces together? Because it looks like a puzzle.
No, it's possible since we have lived with this and we have experimented with the possible arrangements for quite some time now. There are lessons. I mean, once again, I would go back to the Mumbai example. Mumbai, I would think, would be better prepared from all these points of view which you listed. And there is a concrete result available. But every city cannot be a Mumbai. And so what local adjustments need to be made, that is what is important in this context, because again, it is clear that the capacity which Mumbai has or the organizing skill which Mumbai has, that need not be present everywhere else. So what people should learn by listening to discussions like this or reading about this is that what is it better that we can do? Like all your award presentations, see, each award instance is a learning opportunity. Others could learn and see what best I can do in my given circumstances. So one good thing which is emerging is that, I think the central government also has realized that it's better left to the states, but then states should accept responsibility for that. And states should share what is being done with the center also, because ultimately it is a center which gives the facilitation, support and directions. So there should not be an issue of center versus state or state versus the others. The political color should not come in. It should be a sharing of experience. What X states does well, if that is shared, Y state could look into that and go accordingly. But the point is, time will not wait for us. We cannot have this experimentation and then sharing the experience and then doing it. So the first point is how best we can prepare for ourselves. It could be a wave, it could be something else. It could filter down to lowest levels. There are issues, problems. Even vaccinated people probably do not feel very, very safe. I don't know what the medical science has to say about that. So taking all this into account, what best is a possibility of preparing ourselves? And that is something which has to emerge at this stage. I think the states will have to give the leadership and the districts or the local bodies will have to get into the act very proactively. I mean, let's take the case of a municipal corporation or a municipal council. How best they can handle that? What is the extra support they need to get from the system? That should be lined up. And ideally, again, I go back to my point made earlier. If there is a disaster preparedness plan at the district level, that would address very many of these issues, and one needs to go through that and update it or modify that in the context of the experiments made or the experience we have had. I think that will make a big difference. So I don't know whether a single page solution is possible. It will again be fine-tuned to the local requirements, but awareness is important. Knowing about what all can come up, what all needs to be addressed, that is important. I think in the earlier scheme of things, oxygen, I don't know, was an issue which was foreseen or not foreseen, or one did not have the capacity. But once it was highlighted right from the center, that could be addressed in the best possible manner, so much so that today people are not really discussing about it. So many plants are coming up, something which should have happened long back, and it would have been possible with CSR funds and other support, it would have been possible, but no one thought about it. Similarly, there could be certain points about which one hasn't thought about in the context of a huge wave or a different type of wave. So to the extent possible, how best we can prepare that, that is critical. Thank you.
Thank you. May I invite Haryana to respond to what Dr. Ramachandran said, the level of preparedness at the state level, both in terms of disaster, capacity building, and the availability of the required infrastructure.
Yes, I have heard what Ramachandran sir has said. I would like to say that with respect to oxygen, he has pointed out something. See, with respect to Haryana, I can say that we initially were very comfortable with oxygen availability because we have a plant at Panipat, and we were very sure that in case of any emergency, we'll be getting around 300 MT of supplies at any point of time from Panipat. And when the second wave has not yet come, our demand was only, you can say 50 to 60 MT per day. But all of a sudden, Government of India did some planning and gave the supply from Panipat to other states as well. It gave it to Delhi, NCR, it gave it to Punjab, it gave it to UP, Western UP. So that is why our plan got disturbed. And then Government of India did some allocations for the oxygen for Haryana, from Gujarat, from Jharkhand, from Orissa, and from other far-fetched places, from Roorkee in Uttarakhand, and from other places, from where it was very difficult for us to get the oxygen. So oxygen challenge was, in a way, it was not something which was created by us or which was pre-planned by us, because we were assuming that Panipat in any case will be mapped to us only. With respect to manpower, sir, I would like to point out that as I have shown in my presentation, we have taken around 1,000 employees on contract basis, and we have given them good salaries. And we are constantly doing the capacity building of those employees also and our regular employees also. And with respect to infrastructure also, now at present we are better placed as compared to 5 months down the line. But you never know, because second wave was not a wave, it was kind of a tsunami. Because the kind of oxygen requirement that was there, the kind of bed availability that was needed in our urban health infrastructure, it gave us a big lesson, not only to Haryana, to the entire country, that we are spending every bit and every penny on our primary healthcare since last 70 years. We have not spent enough on our tertiary healthcare. What was needed was an expenditure that should have been done on the tertiary healthcare. Everyone ran from pillar to post for a bed. Everyone ran from pillar to post for oxygen and ICU. And then the doctors were not available. The anesthetics were not available. Intensivists were not available. Ventilators were at the last moment, they were made available, but then manpower was not there. So it was something which was not, I can say, which was not planned properly beforehand. But now, if we are planning for the third wave, I think we'll be better placed. With respect to people, also, I must say, I have heard one of the experts, Mr. Madan, he was telling regarding the market behavior, and it is a fact. Entire market is based on fear. When the vaccine was launched by Prime Minister, and there was no second wave at that time, and nobody was willing for vaccination. We used to go after people, and we have to tell them that please get yourself vaccinated. It is high time. Even the healthcare workers were not willing. There was such kind of a hesitation. And when the wave started, then the fear market started coming in the picture, and then everyone made lines for that, and then everyone said we need vaccination. And then the age groups were expanded, initially 60 year to 45 year, 45 year to then 18 plus year. So obviously the plan should have been that it was made in a graded manner only, but we were not having that kind of supplies that we could have been able to cater to such a big market. But it is based on fear only. Again, now the second wave is down. Again, people will not start coming for vaccination very soon. They will forget this thing, because in the rural areas they have not seen the kind of fear that was seen in the urban areas, the kind of deaths that we have seen in the urban areas. So we are fearing this thing again might happen, that people may not start coming for the vaccination, or they may forget what was seen in the second wave. So and on the supply side also, on the government side also, for providing oxygen, for providing manpower, for providing infrastructure, government was also, I must say that, was taken by a surprise, because certain things would have been in place earlier, but nobody apprehended the second wave. And we opened the markets very, very early. Now we are opening, like you yourself are saying, that now we are opening the markets, but in a graded manner. Every state is opening the market, but in a graded fashion, particularly southern states in Kerala and Tamil Nadu and Maharashtra, where still there are cases and where still the positivity rate of some of the districts is more than 10%. They are still opening the market in graded manner. We have seen the spike in Australia also recently. We have heard that lockdown has been imposed in 5 or 6 cities. We have seen in New Zealand also, in some of the countries again, we are talking about the Delta plus variant is coming. So it is we have to exercise caution. As a citizen also, we have to exercise caution with respect to COVID appropriate behavior. We have to follow, and on the government side also, we have to increase the supplies, whether it is oxygen, whether it is manpower, whether it is doctors, whether it is beds. And the last thing, the most important thing that Ramachandran sir also spoke about, and you also told that communication. Communication is the most important thing. We have to talk to the people on every issue. We have to tell them on a real-time basis whether the beds are available, whether they are not available, whether the oxygen is there, whether it is not there. But we should not hide anything from the public. That is the most important thing. There were some channels who were, and I must say, channels must do the right thing. They should report the right thing. Whether there are dead bodies in the Ganga, whether there are something happening, mishappening, or some negative things happening, they should report it. That is their job. They are not here for placating the governments. They have to be the fourth pillar of democracy, and they have to show the true picture. What is the true picture? So I must say that some of the media channels, they have done a good job. And we as a government, we should feed them with the right picture, and definitely they will show what is the true picture to the public also. And together, I think, as a public, as a media man, as a government, we will together, I think, will be able to manage the pandemic in a better manner. Thank you.
Thank you, Prabodji. There is a question that has come in from one of the participants, Srimanta Satpathy, and I think this is directed at Professor Khan. Can you elaborate on the impact of supply chain in agriculture sector? It's been shown that produce has been wasted a lot due to lack of storage facilities and especially due to lockdown restrictions, migration of labor in agriculture sector, which has already been distressed.
Very true. I think that is a legitimate question, and Srimanta, you are absolutely right. There has been a big disruption. You know, we've seen it in the numbers, we've seen it in the press. The amount of agriculture produce that is lying out there unharvested or not transported. It was bound to happen, and I don't think that we should be surprised with that. The only thing that one would have expected was something that some of us have been arguing for a long time now, that we had to provide for some cash transfers to at least the poor. That there was simply no reason for us not to do that. Some of us argued that it should be at least $50 a month, 4,000 rupees, 6,000 rupees. I think that it's still not late. We should do that. It's not too much money. The Supreme Court has somehow convinced the government to do 4 lakhs for the dead, 4,000 for the living. I don't think that is a problem. So the supply chains, and the agriculture reform is a separate issue altogether. But for the moment, we will have these supply chain distortions. And if we want to protect livelihoods in rural areas, we should go back to doing cash transfers, definitely.
You also talked about, data ambiguity.
Yeah.
So what is it that needs to be done so that, there is no ambiguity, how it can be straightened up so that, right kind of decisions are taken both at the center as well as the state level while implementing the new directives as well as the new instruments?
Yeah. We are very polite people. So we don't like to talk about death. And therefore we want to hide the number of deaths. We want to, show that not as many are dying. It doesn't serve anybody's purpose. We have to be brutal about it. If 4 million people have died, so be it. If 3.5 million are COVID deaths, so be it. It is the death data that will give us the ammunition we need to tackle the third wave. It is not the data of those who have recovered. Because that's what we need to avert, isn't it? And therefore, we need to study what is happening. What are the demographics? We still don't know. Do we know whether 70% of those dead are above 75 years old? Except for Mumbai, I didn't get any such data from anywhere. So it is important for our scientists, our epidemiologists, our policymakers, those who are going to target the vaccines. It is important to have very clear, updated, real-time data. I don't know why I have to say it also.
So what's the way moving forward? So problems apart, whatever we have seen, we have seen. Now preparing for the third wave. Three steps.
I think as Dr. Ramchandran said it very clearly, that that we've done several things right. The Mumbai example that he took, the Kerala example, Mr. Rajiv Arora talked about what he's doing in area. I think we have the answers. I mean, I don't see any issues. I think the answers are pretty clear. Data, vaccination, supply, cash transfers. That's from my side.
Dr. Ramachandran?
I just wanted to raise a point for Rajiv Arora's consideration. It's accepted that good work has been done as far as oxygen supply is concerned, ventilators preparedness is concerned, and things like that. We accept that. My point for Rajiv would be, does the state have an appreciation of what the dimensions of the third wave are going to be after talking to experts? I mean, it's not a generalist field. Is there some sort of a picture available, and is the state prepared to handle that accordingly? I accept that it cannot be fully predicted, but I suppose there will be methods of understanding what is it going to be and what is it best that we can do to prevent its adverse effect or reduce it, whichever way it is. Probably if Rajiv focuses on that, that will be helpful because that is a full state's preparedness point of view. Back to you, Bhushan.
With respect to data, we see that, as I said, that on 4th of May, we have seen the peak of the second wave. On that day, we have witnessed 15,700 plus cases, and on that day, active cases were around 1,40,000, 1,50,000 active cases, and out of that, 80 to 90,000 cases were surely home isolation. Now, if we say about the third wave, as of now, nobody has suggested what kind of third wave it will be, whether there will be third wave or not, whether it will be a pediatric wave or not, and what kind of surge it will be, what kind of proportion it will be, whether it will be a tsunami of the tsunami or what kind of wave it will be, we never know. But we are preparing, assuming that minimum 20% rise with respect to per day cases will be there. 20% rise we are assuming minimum, that there will be 20% rise, seeing the rise from the first wave to the second wave, which was around 70 to 80%. So assuming that at least 20%, 25% rise will be there, we are enhancing our infrastructure for that. We are implementing every aspect of infrastructure enhancement, whether it is oxygen, whether it is beds, whether it is manpower. We are working on all the fronts. But you never know what kind of scale it will be, and vaccination is the most important tool in our hand. We have to vaccinate. Right now, we are on the 90 lakh numbers. We have to vaccinate around 1.95 lakh people of Haryana, and we are almost you can say 50%. So we have to vaccinate as many people as we can before the third wave strike. Vaccination is the only important thing that can protect us from the COVID-19 third wave if it happens. Because our hospitals, even if whatever we will say, our hospital bed capacity is limited, people paying capacity is limited, then there are complaints of overcharging, then there are multiple issues are there, and you never know. Like this time, nobody was planning for remdesivir will be so costly. Nobody was planning for amphotericin B. Nobody has would have imagined that tocilizumab will be a life-saving injection, and it will be so costly, and we have to import it from other countries. And you never know in third wave which other medicine will appear. And Donald Trump or someone like that may say that, okay, this will be a medicine which we should purchase, and all of a sudden its prices will skyrocket. So these things, I mean, beyond they are beyond imagination. What we can plan is we can increase infrastructure, manpower. That we are doing, and we are trying for vaccination. That we should at least 70 to 80% population we have to vaccinate within next 2 months, so that we are safe from the third wave. even if the third wave strikes, we should see that its magnitude is not as much as we are thinking. It should not go beyond that. Thank you.
Well, thank you so much. Is there any question?
If I may add a point to Mr. Navjot Singh, this is just to put on record our appreciation for the wonderful work that has been happening in Haryana. More than what you have delivered logistically, it's the compassion with which it has been done. There have been several instances, people who are working with staff with Scotch, entire families being impacted by COVID, and every day they were getting a phone call from the administration and the government on whether they need anything, what is their status. Just that mental support, that government is in touch and bothered about them, is an enormous job. I don't know how many other states were able to do it. And the second thing that I saw, which really touched me enormously, is a special arrangement that were made for people with special needs to get injected. Because there is a very high degree of anxiety. There are people who have accessibility issues, and then there are people who have probably got more anxiety issues or emotional issues. And there is a special handling for such patients required. I have not come across examples from any other state, but I have seen that in Haryana. So God's blessings be added to your work, Navjot Singh ji. That was a wonderful job that your state has done, and I hope you continue to do so.
Thank you, Coach sir. Small correction. My name is Navjot. And thank you for your kind words. Now, you rightly pointed out that our health minister was very keen that on every home isolation patient the call should go, and every alternate day visit should be done. And with respect to special needs, we have given them transportation facility also in Haryana. And I must compliment the work done by my ASHA workers. They have scanned the entire population of Haryana 5 times. 5 times house-to-house survey was done, and we have seen what kind of symptoms people are having, whether they are ILI or whether they are SARI symptoms, and we tested all the population, maintaining RT-PCR is 20 testing ratio. So I must compliment my entire team of health department under the aegis of ACS Health, Rajiv Arora sir, Health Minister and Honorable Chief Minister. I can assure the House that if there will be a third wave, Haryana will be in a better position as compared to second wave to deal with it. Thank you, sir.
Wonderful.
Thank you so much. Is there any other question from anyone? Or we move on to the next? Well, it's time to say thanks to all the participants for sharing your experiences and making suggestions for how to handle the third wave, come out victorious, not get bogged down by our past experience. Hopefully, it should make us stronger. Thank you very much once again, everyone. And